this will probably be the last one for a little bit. I am doing a condensed version of my previous 16-minute long statement about Iowa Medicaid covering gender reassignment. So, to keep it short and concise, it has been my experience that most people in the medical profession got into their careers to make money. There was certainly an idea of helping people, but when it gets down to it, once you're faced with the money, it's about the money. Now, the problem is that our current healthcare system involves a lot of insurance. The insurance supposedly makes it easy for everyone to have coverage. Everyone pays in. It's basic socialism, but voluntary, except that it's mandatory. See my previous video, which is currently uploading, about people who had their way through college paid by bribery because they were not themselves competent to enter those colleges. And then when they graduate those colleges with prestigious Ivy League degrees, they are not necessarily actually experts in their fields, etc. So consider that rich dumbasses who have had their way bribed through college made the laws for things like mandatory insurance. But if you can't afford insurance, you still have to have it. So if you still have to have it, you have to get your state aid. Now, if you are legitimately disabled or retired, I believe you can get on Medicare, and Medicare pays significantly better than Medicaid on any given job. What happens in this process is that because there are insurance companies, the healthcare providers raise their prices. They gouge the insurance companies knowing that it will be paid. So the hospitals make a killing. They pay their employees, they pay their doctors, they pay their shareholders, because usually they're corporate by that time. They pay their shareholders, and everybody's making money. The insurance company, however, has to make money as well. So first what they did was they spent money lobbying idiot, dumbass politicians who did not have the actual competence and clout because of their Ivy League degrees, because they were most likely paid through college. These people were then lobbied to change the laws. We're going to tell people we're going to make health care available to everyone, but then we're going to require that everyone pay into insurance. So then the insurance companies make money because everyone has to pay in. So because everyone pays in, the insurance companies can afford to pay even more, and so the healthcare providers gouge even more. Now what happens is, if we were to do Medicare for all and eliminate private insurance companies, we would have to adjust the cost of healthcare to reflect the fact that this has happened and reduce those amounts. What this means is the hospitals, the shareholders, the doctors not making as much money to do the beneficial life-saving things they have pledged their lives to. And when it comes down to it, as I said, it really just is about money. So most of them might refuse service. And even if the government said they couldn't refuse service, there's other ways around it. And that comes to my point. If you are on state Medicaid, you pay about $5 a month, tops, for your health care. Anything that you go and use, you have to have approved by one of the 3 private companies providing Medicare provision for the state. Maybe it's 2 now. One of them turned out they got in trouble because they denied literally everything. They just said no to everything. So if they do say yes, what Medicaid is going to pay is not as much as what Medicare would pay, which is not as much as what private insurance would pay, which means that the doctors, the hospital, the employees, the shareholders will not have as much profit to draw from to take their share. What happens is resentment. The staff do not appreciate being made to work for free or for less, which is understandable, I get it, but they swore an oath, a Hippocratic oath. And in upholding that oath means providing proper, more than adequate, good service in healthcare to heal people, to do no harm. Instead, what happens is America as a country has dismal outcomes when it comes to healthcare. The reason for this is that people are either uninsured or state Medicaid insured, And the doctors do not appreciate the lack of money coming in, so they half-ass their work. I've seen it. It's happened to my wife a lot. Things come up health-wise, you need checked out, you need looked at. We can't figure out what it is. We better ask the insurance company. They schedule a bunch of exploratories, all of which get denied. After the whole rigmarole, you finally find a doctor somewhere who knows what's up and actually takes the time, and you find that one good doctor and pray that they don't get pulled off your insurance. And it turns out every time that the thing that was wrong was actually something that they knew about the whole time. But they didn't feel like treating it because that would cost money, and if the Medicaid's not paying for it, they don't want to do it. Now, let's take everything I've just discussed as a unit, and let's place it for comparison next to, instead of essential health care over here, right? You're sick, you could be dying, you need surgery for something that is injured. This is real, like, necessary, right? So you have medically necessary, and then you have elective. As far as I know, most generally, state Medicaid does not cover any elective surgery. Even my teeth could only be removed a few at a time. They could not do the whole surgery. They could do a few of the worst and wait for the rest to get worse as well. And when it comes to getting dentures, the state coverage does not provide for a full, only a partial denture. So I could get a piece that fits around the other bad teeth, but I couldn't just get the top or the bottom or both. And to get dentures is something like $10,000 to $15,000, not counting the tooth pulling. So, consider the lackadaisical, laissez-faire, just whatever, dude, just give me the money and shut up and get out attitude. Oh, you're not paying? Well, fuck you then. Attitude. Apply that by comparison of everything necessary that I've just described into the relatively elective zone that is gender reassignment. I'm not transphobic, and I'm not saying that it's not a positive thing for some people. What I'm saying is that this is something that, from a doctor's standpoint, they're going to view like plastic surgery, a tummy tuck, something not medically necessary. Okay, so not only do you have a doctor's distinction between necessary and unnecessary, you're going to have state Medicaid underpaying doctors to do services that they consider to be unnecessary. They are going to half-ass gender reassignments. They are going to botch gender reassignments. You watch and you see what is going to happen. These poor, povertous people that feel that they are transgendered and need to transition, and they can't afford it without good insurance. Now the state Medicaid covers it. They're going to botch these poor people's lives. Think about it. It's hard enough if you feel you're in the wrong body, but then you try and get that corrected and the doctors fuck it up. Think about it. Iowa Medicaid is going to cover gender reassignment, and I have seen firsthand what Iowa doctors do when Medicaid is involved. They give zero fucks about your well-being. They want you out the door so they can see patients with well-paying insurance or cash. That is a fact.